Hello everyone, welcome to my channel. Today in this video I am going to discuss you about the top 15 interview questions for pharma company for quality control and quality assurance. QA interview questions. First is, what is quality assurance? Quality assurance is a department in the pharmaceutical industry that ensures the quality of products manufactured in the company. In general, quality assurance ensures that all medicine manufactured in the company and reaches to patients are safe and effective. QA is a broad concept that covers all matters that influence the identity, strength, quality, and purity of a drug. The quality assurance department mainly responsible for the identity, strength, quality, and purity of drug products. And the next question is, difference between QA and QC. QA is a subset of QA that deals with testing materials and drug products to determine if they meet acceptance criteria. The QA function typically consists of oversight activities and the QC function consists of execution activities. Thus, quality assurance and quality controls are the two basic fundamentals for the drug production. The quality assurance take part in the drug's purity and quality control takes part in the quality control and analysis of the drug. What are the different types of dosage form? As per route of administration: oral, parenteral, topical, nasal, ophthalmic, vaginal, rectal, otic. As per physical form: solid, semi-solid, liquid, gases, aerosol, sterile, novel drug delivery system. So these are the different as per the physical forms. What is a tablet? Tablet is a unit solid oral dosage form. What are evaluation tests of tablets? General appearance, organoleptic, size and shape, dimensions, length, width, height, friability, hardness, disintegration, dissolution, uniformity of content, assay, weight variation. So here evaluation of test of tablets generally have how the tablet appears, dimensions like length and width and height, friability, the hardness, etc. So what are the limits of all evaluation tests? Hardness 5 to 8 kg, friability 0.5 to 1% of the actual weight of the tablet is acceptable. Weight variation: the average weight of 130 or less is 10%. For average weight 130 to 324 is 7.5%. For average weight more than 324 is 5% difference is allowed. Content uniformity: 9 tablets from the first 10 is must contain not less than 85% and not more than 115% of the labeled drug content, and the 10th tablet must not contain less than 75% and more than 125% of the label claim. If fails, all remaining 20 tablets must be assayed individually and none may fall 85 to 115% range. Next is disintegration test. For uncoated tablets 5 to 30 minutes. For coated tablets 1 to 2 hours. Dissolution test. Stage 1, 6 tablets are tested and are acceptable if all the tablets not less than the monograph tolerance limit plus 5% if fail. Stage 2, another 6 tablets are tested. Take 6 tablets test individually. Average weight 12 tablets are greater or equal to but no one less than 15%. If the average of the 12 is greater than or equal to Q and no unit is less than 15% if fails. So here the dissolution test for stage 1, stage 2 and stage 3, another 12 tablets are tested. The tablets are acceptable if the average of all 24 tablets is greater than or equal to Q15. 2 tablets are less than Q15. Next is, what is dissolution test? A dissolution experiment evaluates the rate and extent that which a compound forms a solution under controlled conditions. What is disintegration test? Disintegration testing measures the ability of a tablet to break down into smaller particles or granules to allow the active drug to be absorbed into the body. What is FTIR and the range of frequency? Type of spectroscopic analysis. It is an instrumental method used to measure the absorption of electromagnetic radiation over the wavelength range between 4000 and 400 cm inverse. What are UV and range? UV visible spectra are derived when the interaction between incident radiation and the electron cloud in a chromophore results in an electronic transition involving in the promotion of one or more outer shells or the bonding electron from the ground state into higher energy. What is a limit test? Limit tests are analytical tests that are used to identify quantitative or semi-quantitative tests designed to identify small quantities of impurity which is likely to be present in a substance. Types of limit tests. Limit tests to identify inorganic impurities, chloride, sulfide, iron, lead, heavy metals, and arsenic. What is chromatography? Laboratory technique for the separation of components in the mixture based on the distribution of components between two phases. Types of chromatography: absorption chromatography, thin layer, column, partition chromatography. What is a gas chromatography? It is an analytical technique used to separate the chemical components of a sample mixture and then detect them to determine their presence or absence and or how much is present. So these are the basic questions for pharma interview in QC and QA. If you like the video, please subscribe to channel, like, share and comment, and don't forget to subscribe to my channel. Thanks for watching.